Hello and welcome back to Mirror Interpretation Todorova. Welcome back to my YouTube channel. My name is Ioana. I am an interpreter and a polyglot. And in this series of videos, I'm recording consecutive interpreting practices. This is interpreting sessions that I have done. I have removed all the personal information and created those trainings for you guys in order to help you practice consecutive interpreting practice. This video it's called pregnancy screening and training. That video will last about 20 minutes. It's consecutive medical interpreting practice. To help you prepare to interpret for that session, I would let you know that we have an English speaker who is reading instructions or questions to not English speaking a client, a patient. This is pregnancy screening and training. And the mother does not speak very much. There is just very few words that the non-English speaker say. So you're gonna have this training, consecutive practice in English language, and you can interpret versus the other language. Let's start. Pregnancy screening. In this section of questions, you have to choose from the answers never, several days, almost every day, or every day. I have little interest and pleasure in doing things. I feel down, depressed, or hopeless. I have difficulty to fall asleep. I struggle with insomnia, or I sleep too much. I can't wake up. I feel tired or low energy. I have bad appetite or I eat too much. I feel bad about myself. I am a failure. I have disappointed myself, my family, and I have let them down. I have problems with concentration, including reading a newspaper or watching TV. I think I will be better off dead, or I'm thinking to hurt myself, ending my life. Now in this portion, I want you to answer how much your problems affected your day-to-day life or your care, interactions with self or with others. And the answer would be, for me, it's slightly difficult, somewhat difficult, very difficult, extremely difficult, or it's not possible to deal with. You have to choose from those answers. Okay? And now I want you just to know that these questions I need you to answer for the past 2 weeks. So you have the answers and you need to respond just for the last 2 weeks. Okay. Have you feel nervous, worried, or on edge? You could not stop or control your worrying. I worry too much for different things. I have difficulties to relax or calm down. I feel so overwhelmed, overactive that I couldn't stop, relax, or sit down. I feel overly worried, overly active. I feel easily triggered or feel not pleasant sensations like I am constantly irritated. I feel fear as if something very bad is happening or could happen. And now the last question is how much of those facts that we discussed affected your ability to take care of your child, household, or interact with others? So, in our trainings together, we usually discuss the child growth and then we do one activity together. Okay. Usually, our meetings are no longer than 1 hour, but this is our first meeting with the child and you, so it's a bit longer. This first portion that you could see on the day plan in front of you will be tongue, movement, motor system, motor brain development, and so on. The next form will be things that you notice the child does. As example, from the day of delivery, from birth, the first 6 months, the child will do those things. On the right side, you could see will be things that you can do to help the development of your child. In the first, you will notice the child will cry if she is hungry or he is hungry or feel discomfort, or sometimes the child will cry, which is the way a child communicates frustrations or emotions. Just have in mind reasons when the child cry. If the child cry, the only way it's the only way the child communicates. Sometimes there is no reason. But be mindful to respond when the child is crying. The child will sleep a lot and often. And after we look all the things around, like the objects, the people. Now, the most important is if the child feels like sleeping, allow the child to sleep. Sleep is very important for the child development. So now the child can see around her in a distance 8 to 15 inches. This means that each toy you put on this distance, the child will see it and react on it. Ah, between 18 and 15 inches distance. I understand. Okay. It is very important that you talk to her and explain who is next to her, who is this person. We gonna eat, we gonna change diapers. Talk to the child. This is very important for the child development. Also have in mind that if the child touch his fingers, hands or other object, this is calming the child. The child is constantly looking for different ways to calm down, and this is one of the ways. Also have in mind that the child at her age has something called a scare or startle reflex. A very small thing can scare the child, so it is important the environment to be calm, relaxed, and relaxed around the baby. Yes, and you can cover the child with a blanket, but just have in mind if she hears sounds or a new sounds, new voices, be aware of the startle reflex because she can hear it for the first time, and this is the effect. Regarding the care of the child, we will do different things. Change diapers or feed the child together when I am with you. Yes, and if we change diapers, it's always important to talk calmly to the child, tenderly, uh, so the child feel comfortable and safe. You can put the child on your chest. This is usually calming down a child because on the chest the child listens to your heart rate. This calms children down because they are used to hear this sound since they were inside of you. This really helped them calm down. Also, if you want to calm down your child, you can sing a lullaby or a child song. If you sing, the child relaxes as the child know your voice since the child was in your stomach. If you talk to the child at any time, this is going to develop the vocabulary of the child and help the child to speak or know new words. If mom and dad speak, this is very good. It helps connection between the child and the parent. This next portion, it means the ability of the child to recognize smells. It's developing at this age. The child can feel or smell, for example, the milk smell and so on. The next time we're going to discuss different things about and answer questions and situations about the child. When the child is a 1 month or 1 month and a half, we can discuss a baby massage. I will bring with me a doll next time, and I will do a massage to the doll, and you will see how to do it, and you will do it to your child. We're gonna practice a baby massage. This massage is very good experience, an exercise which will help strengthen your connection and bond between you, the father and the child, and this is very good exercise to help you bond. Okay. Usually, the massage of a baby helps the baby to realize that has hands, feet, belly, and so on. When baby is in the mom's stomach, they're in the fetal position. They don't realize its body parts. Now, when you do a massage, slowly, they start to understand it's their fingers, their hands, their feet. They start to understand and feel their bodies. Do you have any questions? No. So now we're gonna discuss the schedule. So can you do Thursday at 1 p.m. or Wednesday at 11 a.m.? What time is better for you? I can do Wednesday at 11. Okay, see you then. Thank you, interpreter. And thank you guys for using this practice with me. Thank you for doing this practice with me. As you can see, I'm ready to say thank you for using our services. It's automatically happening in my brain and I am saying it. That was the pregnancy screening and training, guys. Very interesting script, real lifetime script training or education for parents, where the mother said just few words and we had the person who explained to the mother different things about childcare. I hope you enjoy practicing with me. Please, I do hope that you had enough times to interpret. If sometimes see that you guys comment that I should slow down, I can adjust that, but I believe that there is enough time to interpret for all the languages in the poses. Thank you for being here. If you'd like to practice with me, press like, share, and subscribe. Bye-bye.